Hi, and welcome to Talk Sex with Dr. Siciliani. I'm Jonathan, and this is Dr. Siciliani. Dr. S, can you tell us something about yourself?
I am an associate teaching professor at the University of Missouri St. Louis, and I have been researching biopsychology for a number of years, but specifically human sexuality and the ramifications of human sexual behavior. So that's, I think, why Jonathan and I are here to take your questions, and we're really glad that you sent some in. So welcome.
Okay, so Dr. S, the first question that was sent in was, does masturbating to the side make your penis curve to the side? If not, how does it get curved?
Well, to answer the first question, no. Masturbating to the side does not make your penis curve to the side. The entire human body is putting together of two halves. So there is something called fluctuating asymmetry. That's the degree to which the two sides don't exactly agree. So if you draw a perfect circle and you fold it in half, then those two sides are going to overlap perfectly. But as many of you know, if you look at yourself very carefully during those tumultuous teenage years when you're staring in the mirror at yourself, you notice that one eye is lower than the other, one ear may be lower than the other, and certainly females will notice when breast is a different size than the other, males will notice when testicle is a different size or different placement than the other. The same thing with the human body, and specifically the penis and the development of the penis. Those of you who own one of these, you know that there's sort of a seam running down the middle, and that seam accounts for this asymmetry. And so, in general, actually, most men have some curvature, and most of that curvature is either up or to the side. So, in a chicken and egg scenario, the to the side curvature of the penis came before any of the masturbation. So, no, it cannot affect it, cannot make it more curved. I guess we do want to talk about pyrones. Did you want to address that?
Yeah, can you mention a little bit about that?
Sure. One of the things that Jonathan and I were discussing, we don't want to leave this topic without mentioning Peyronie's disease, and this is a name for a syndrome that can happen due to repeated small injuries to the penile shaft, and what that means is through some kind of trauma, and that trauma can actually happen during sexual activity. When you're interacting sexually with someone, the penis can be bent a certain way, too much, or pressure can be put down on it vertically, and that can cause the penis to sort of bow out a little bit. And when it bows out a little bit, some of the veins and arteries can break. And when they break, there's a little bit of bruising in there, and if the bruising heals such that scar tissue forms, it can cause that bending shaft to bend just a little bit more. So those are generally not things that happen without repeated small injuries, and you generally know that they're happening. So you can make a penis significantly more curvy with injuries or Peyronie's disease. Yeah, so if you and everyone will indulge me, I did want to talk about an extreme case of Peyronie's, and we sometimes refer to this as a broken penis. So through serious pressure exerted on the shaft of the penis, the bending can be such that it's such a severe bend that the vasculature, the veins and arteries on this side do become bruised, they bleed out, and this is an extremely serious condition that has to be treated right away. You have to go to the emergency room for this. And so if the penis is left in that bent position, what happens is it'll heal that way. So we're not talking about the original person's question now. We're talking not about a slight curvature, but something that's very serious, very noticeable, extremely painful, in which case it has to be brought back up to a straight or original position, and it has to be splinted into place so that it can heal and those veins and arteries can heal again. So I think our friend was asking about slight curvature. But we did want to talk about the fact that there can be serious curvature resulting from serious injury.
Well, that was actually a very informative answer. Thank you. The next question that we ended up having was one of our male viewers asked, he said that people kept on mocking him about his virginity and was wondering, is it because he is a 21-year-old heterosexual male? Mm-hmm. Do you have any opinions on that?
Sure. I mean, I think it's difficult to answer specifically why anybody would be mocking you, and thank you for the question. I certainly don't think you're alone. Studies show that if you reach the age of 21 and you are still a virgin, there's absolutely nothing wrong with that. You are in a statistical minority. Whether or not you judge that as fortunate or unfortunate, everybody has their own opinions on that. However, I would guess that this particular person, because he's 21 years old and still a virgin, and because that can be considered a minority, that may count for some of the mocking. But my sort of next point that I notice about this, and something I want to speak to, is the fact that it's a male. And I think that all of us can agree, I'm not telling you anything that you don't know, that there seems to be a bit of a double standard.
Yeah.
I think that females in general are, supposed to keep their virginity intact as long as possible. And I think that males are
Supposed to lose it as soon as possible.
Considered successful if you achieve the goal of losing it. Females are considered successful if they achieve, holding on to it. So when I hear that question that you read, Jonathan, I do think to myself that could have something to do as well with him being male.